Hey everyone, Dr. Markandaiya here, and today we are talking about rheumatoid arthritis or RA. RA is a common autoimmune disease, but unlike osteoarthritis, it is not caused by wear and tear. Instead, your immune system, which normally fights infection, mistakenly attacks your joint. Genetic plays a crucial role here. If you have a close relative with RA, your risks are higher to get this disease. RA usually affects the small joints in the hands and the feet, but early signs can be very subtle. So let's explore some of these lesser known symptoms. First is fever. A low grade fever, especially in the evening, along with fatigue and achiness, can be an early indicator of RA. Second is extreme fatigue. Feeling constantly exhausted even after a good night's sleep is a common complaint with RA. Carpal tunnel syndrome, if you experience numbness, tingling, or weakness in both hands at the same time, making it difficult to type or use your hands, it could be carpal tunnel syndrome and an early sign of RA. Fourth is dry eyes and mouths. Feeling like your eyes are gritty or red or having a constantly dry mouth that requires constant sipping can be an early sign of RA. Rashes or nodules, small painless red bumps on your legs or changes in hands or toe color when cold, which is called otherwise known as Raynaud's phenomenon, could be RA related. Of course, the most common symptom is joint pain, but in the early stages, it can come and go, especially in the mornings. Stiffness that improves throughout the day can be a sign as well. Here are the key takeaways. Don't ignore these early signs. Early diagnosis of RA is crucial to prevent joint damage and improve your quality of life. If you have a family and experience some of these symptoms, see a rheumatologist, a specialist trained in diagnosing and treating RA. They can use advanced methods including blood tests and genetic assessments for comprehensive diagnosis. Remember, we treat the whole you at this stage of the disease, not just the disease. We offer a holistic approach that includes nutrition, physical therapy, mindfulness, and practices alongside with targeted RA treatment. If you have any question about RA, leave a comment below and don't forget to like and subscribe for more informative videos like this.